On the day of the procedure, a very typical scenario is the patient arrives approximately an hour to an hour and a half early prior to the procedure at the surgery center, and they're prepped, which means they get into a gown, they sort of get ready for the procedure, they talk to the nurses, they make sure everything is ready to go. A board-certified anesthesiologist will sit and talk with the patient and come up with a plan for their anesthesia, and you'll see your surgeon. When I see my patients, I come in, we chat, we talk about last-minute items, clarify any last-minute questions about what to do right after the procedure, what to do when they go home so they have a comfort level about what to expect. I get to draw it all over them, which is kind of fun. And I draw my lines of what I'm going to do, and the patient gets to see it, and we all agree to that final treatment plan. Then the patient goes into the procedure room and has the procedure done. What may typically last about 2 hours during the procedure, to the patient it seems like 2 seconds. They wake up in comfort and they go to recovery room. And that's really important, because no matter how great these results may look, we want the patients to be safe, we want the patients to be comfortable. So when they're in recovery and they feel actually very nice and they seem to be doing very well, maybe an hour into it, sometimes an hour and a half, patients are ready to go home. They're talking, their family members or friends that are there to support them are there, and the patients are released to go home, and they do best by being in their own home, in their own environment. If a patient has any questions after that, they're more than welcome to call us. We're always available 24 hours a day to answer any questions at all for patients. And generally we'll see them maybe about a week later for their first visit after the procedure.